So my name is Stacey Fields. I am an emergency room registered nurse, and I will be your moderator for the evening. We invite everyone as the presentation is going to post all of your questions in the Q&A section of the webinar, and we will get to questions in the end. At this time, I would like to turn it over to Janelle Lawson, who is the chair of the Black Maternal Health Project.
Hi, good evening, everyone. As Stacey just shared, my name is Janelle Lawson, and I am the chair of the Black Maternal Health Project, as well as the Deputy Director for Community Action Agency, which is located in New Haven. And we actually change people's lives by creating pathways to prosperity. And in a 9-month period, we see over 12,000 families. If this is your first time joining our webinar series, welcome. And if you're returning, thank you for your support. The Black Maternal Health Project is a collaboration of 4 nonprofits in the greater New Haven area: the Community Action Agency of New Haven, the National Coalition of 100 Black Women Metropolitan Chapter, the New Haven chapter of the Links Incorporated, in New Haven Healthy Start. We came together in a united mission to use our superpowers to create awareness of the disparities that Black and Brown women face when it comes to childbirth. Now I'd like to hand it over to my co-chair, Tony Harp.
Hi, my name is Tony Harp, and I'm the president of the New Haven, Connecticut chapter of the Links Incorporated. The Links Incorporated is an international, not-for-profit corporation established in 1946. It is one of the nation's oldest and largest volunteer service organizations, committed to enriching, sustaining, and ensuring the culture and economic survival of African Americans and other people of African ancestry. For 52 years, the New Haven chapter of the Links has served the greater New Haven community through 5 service areas: the arts, services to youth, national and international programs, and health and human services. Our chapter is delighted to be a partner in the Black Maternal Health Collaborative. Its mission aligns with our organization. The Black Maternal Health Project is dedicated to empowering Black and Brown women to effectively navigate the healthcare system, to eliminate disparities and maternal mortality rates by achieving positive health outcomes through a comprehensive approach that includes advocacy, community engagement, and education. And now I'm going to introduce you to our other co-chair, Lorraine Gibbons, who is the president of the National Coalition of 100 Black Women Metropolitan Chapter.
Thank you, Tony. Good evening, everyone. As you heard from Tony, my name is Lorraine Gibbons. I'm the president of the New Haven chapter of the National Coalition of 100 Black Women. We are one of 62 chapters across the entire United States. Our national organization is based in Georgia, where we have about over 3,200 members. We are in 26 states. And the mission of the National Coalition of 100 Black Women Incorporated is to advocate on behalf of Black women and girls to promote leadership development in the areas of health, education, and economic empowerment. And so likewise, our mission falls nicely within the mission of the Black Maternal Health Project. And so the vision of the Black Maternal Health Project is that we strive to create an equitable healthcare environment where every woman can access the resources and support necessary for a healthy pregnancy and childbirth experience. And so we do this through ACE, and that's advocacy, community engagement, and education, ACE. And then I will turn this back over to Stacey Fields, our moderator. Stacey?
Thank you, Lorraine, for that. And now on your screen, you should see our advisors. And we have Janelle Lawson, who you heard from, our chair, Tony Harp, our co-chair, Lorraine Gibbons, our other co-chair, Dr. Cynthia McCraven, Medical Advisor, Miriam James, Strategic Planning Advisor, Sonia Brevard, Health Committee Chair, Dr. Gretchen Vaughn, Mental Health Advisor, Natasha Ray, Advisor, Peyton Owens, Project Manager and Marketing Advisor, Maritza Bond, Public Health Advisor, Stacey Fields, Health Committee Advisor, Kai Perry, Project Manager and Advisor, and Dr. Sharon C. Jones McCann, Advisor. Postpartum depression is the most common maternal health condition that we hear about. However, there are many others that are equally as prevalent, such as depression, anxiety, obsessive compulsive disorder, post-traumatic stress disorder, substance use disorder, and many others. To explore and discuss maternal health, we welcome our panelists, Dr. Cheryl Henderson and Novella Atkinson. Dr. Henderson is a clinical psychologist in New Haven, Connecticut, practicing for over 30 years. Her specialty is working with women, in particular Black women, dealing with depression and anxiety. Dr. Henderson received her BA in psychology from the University of Southern California, a MED from Loyola University, and a psychology doctorate from Wright State University School of Professional Psychology. She is a graduate of the National Training Laboratory Professional Development Program and completed her pre-doctoral internship at Yale University School of Medicine. Welcome, Dr. Henderson. Novella Atkinson is a dedicated licensed master social worker with over 27 years of experience. She currently serves as a program manager at the Department of Children and Families and is passionate about addressing systemic disparities impacting Black and Brown families in the child welfare system. In addition to her impactful work in social services, Novella is the owner of Asantewa Fitness and Wellness, a boutique fitness facility located in Hamden, Connecticut, where she focuses on combating chronic health conditions disproportionately affecting communities of color through inclusive and empowering fitness programs. Novella is an active member and serves on the executive board at Life Changing Outreach Ministries. She is also a proud member of Alpha Kappa Alpha Sorority Incorporated and the National Association of Business and Professional Women's Clubs Incorporated, where she continues to champion initiatives that uplift and empower her community. As a member of Phenomenal I Am, she dedicates her time to guiding and inspiring young girls. A trailblazer in social justice, health equity, and community development, Novella Atkinson is driven by her passion for creating lasting change and improving lives. Welcome, Novella. So again, I invite you all to place your questions in the Q&A portion of the webinar, and we will get started with Dr. Henderson. Can you give me some background on the amount of women, specifically pregnant women, that are currently facing mental health struggles?
Sure, Stacey. And before I answer that question, I want to just say thank you for having me tonight to discuss this very important topic. I want to start by just say, as you had said, I have been in practice in New Haven for over 35 years, and my practice consists primarily of treating Black women with anxiety and depression. Now, on a global level or national level, many studies have reported a range of depression in Black women from 45% to 60%. That's a lot, right? However, if you look at who's getting treated or how many of those women are getting treated, only about 7 to 12% of women who suffer from depression are being treated for it. There's a big gap, and there are many reasons for that gap. Some of them include the big R, racism, and others that are include a stigma. And one of the big stigmas that I see operating that drive people into my practice are the stigma of the superwoman, She's strong. She don't ask for help. She suppresses or represses her emotions. She doesn't ask for help. And she is last on the list for care, for her own self-care. She cares for everybody else but her own, but herself. And she is unwilling to be vulnerable. She's not going to ask for help. So how does that play out in terms of what we're talking about tonight, mental health in pregnancy? And I'll start by saying, as Stacey mentioned, it's not just after pregnancy that we look at it. It's before, during, and after. In a recent study, it was found that 50% of Black women experience depression after giving birth. The same pattern exists. It is underdiagnosed and undertreated. A study that was done by the state of Connecticut that looked at mortality rates of pregnant women from, I believe it was 2015 to 2020, found that many of the women had previous mental health diagnosis, and it was not screened for or treated during their pregnancy. And the most galling part of this, of the findings of this project, is that 80% of the mortality was preventable. So that frames this issue that depression is underdiagnosed, undertreated, and it results in some very serious outcomes if it's not treated.
Thank you so much for that, those points that you brought out. And maternal health, mental health conditions are some of the most common complications of pregnancy and birth that affect annually about 800,000 women or families in the United States. And it was also found that about 75% of those women that were impacted by maternal mental health conditions went untreated. So this is really bringing light and awareness to that problem that exists and the need to do something about it.
Yes,
So now, yeah, absolutely. So thank you
absolutely.
for lifting that up. Novella, given that Black women experiencing depression can present differently than white women and display things like irritability, self criticism, fatigue, those things that can be misinterpreted, in your clinical experience, do you see mental health concerns being overlooked in Black and Brown women and possibly being treated punitively instead?
Absolutely. And I just also want to thank you. And it's such an honor to be on this panel with you, Dr. Henderson, with your experience and your knowledge, as well as you, Stacey. And thanks again for the invite. But to answer your question, absolutely. As you said, Black women who express frustration, anxiety, are often labeled as angry. We all know the angry Black woman stereotype, and we're perceived as angry in child protection. We call it uncooperative and aggressive, and because of that, more punitive types of referrals are made instead of referrals for mental health or referrals for supportive services. Black women are often referred to DCF, referred to the criminal justice system. And that's why we have a disproportionate amount of Black families in the child welfare system. I sat in at a local hospital. I won't name what hospital it is, but I sat weekly in a meeting with the pediatric department And we talked about the disparities, how a white woman and a Black woman would have the same issues, and the Black woman would be referred to DCF because of implicit biases and stereotypes and a lack of trauma-informed care. So, we would have a mom who was a Black mother who's experiencing postpartum, and because they didn't meet that level of standard for nurturance, or they would be referred to us. And so I can't tell you how many cases that we have where we don't need to be involved with the family. It could have been a referral for mental health services, and instead it's viewed as neglect, and it's that over policing in the healthcare systems of Black women, particularly, that results in those punitive type referrals.
Yes, and so it's found that the screening tools that are used to identify mental health issues do not always account for the specific factors that Black women present with. They don't account for discrimination, for racism, for environmental concerns, job opportunities, financial constraints. So there are some screening tools that have been developed to address and account for these factors. And we need to really lift up and encourage the use of those tools so that we can make sure that we are accurately identifying mental health concerns and treating them properly so that we don't end up with situations of family policing and separation, which will further impact the mental health of the mother. So now, Dr. Henderson, I want to bounce back to you. Can you explain to us how mental health changes during pregnancy?
Well, Stacey, I want to start by saying that during pregnancy, it is normal to have mood changes. At one minute, you can be excited and happy, and another minute, you are down in the dumps, down in the valley, so to speak. And some of that is normal. That is a normal part. And when it happens after delivery, many people call that the baby blues. I mean, and that can last for anywhere from 4 to 5 days after, up to 3 weeks. But if it lasts longer than that, then that's cause for concern. So, however, I do want to talk about some serious conditions that happen during pregnancy and can happen after pregnancy. The first one I want to just mention is pregnancy. Ooh, I'm having difficulty here tonight. Pregnancy-induced psychosis. It's extreme, and the research says that it happens 1 in 1,000 births. This is a severe condition. It is to be taken seriously. And you need, in most cases, medication and treatment, psychological treatment. Depression, talked about some of the dynamics with depression, that it is a feeling of being in the valley, hopelessness, helplessness, restlessness. And as Stacey referred to, it could be seen as anger and irritability and so forth. So all of those are symptoms. And if they persist, some of that, as I said before, is normal, but if it persists, it is a serious condition. PTSD, many women experience birth trauma, and when they have another pregnancy, it's a traumatic event, and it needs to be addressed. And if you've had a psychological reaction during pregnancy in the past, then it's a good predictor that will happen again. Some risk factors for having a serious psychological event, as I would call it, during pregnancy or after, are extreme financial concerns, some type of trauma or grief reaction, as well as the idea of an unplanned pregnancy. All of those things can be risk factors for having these conditions.
Thank you. Very, very important points that you brought up. And I'm sure things that some of us, may have even experienced. Novella, we're going to come back over to you. Can you explain the stigmas that exist in the Black or Brown communities regarding mental illness and how it affects them seeking care?
Absolutely. So I think one of the big ones is the cultural perceptions of mental illness. It goes back to what Dr. Henderson was saying. I think in the Black and Brown community, we tend to perceive mental illness as a weakness. And, it's something to be ashamed of. I think we're more likely to disclose and share a medical diagnosis with family members or loved ones rather than a mental health diagnosis. For example, we fear being judged or called crazy or acting weak. So we tend to dismiss or downplay our mental health issues, right? Some cultures prioritize faith, which is great, but we may seek counsel from our pastors or our spiritual leaders rather than going for mental health services. And I think also there's a mistrust, the discrimination that we face with the healthcare system, mental health systems. There's been a mistrust because we've been mistreated, misdiagnosed. And so that causes us to be reluctant, right, to go for services where we don't feel seen or we don't feel heard. And again, we're going to get those punitive referrals if I go and I seek services from someone who doesn't really understand me. So I also think there's a historical context. Mental health stigmas in Black and Brown communities are deeply rooted in historical and systemic racism, right? With communities often being underrepresented or misrepresented in mental health discourse. There's a lot of reasons. I think another reason, I know Dr. Henderson talked about the Black woman and that superhero and we're superhuman, and I think it results in a lack of knowledge of when we are really experiencing mental health symptoms. When we have experiencing clinical depression, oh, I'm just tired, I'll shake it off, I'll talk to my girlfriend and keep it moving, and just not really understanding what those mental health symptoms are and going for treatment. So I think that hinders sometimes us going for treatment as well.
Yes, and the superwoman schema has been brought up multiple times, and to most people, it's something they not so lightly joke about, but it is so real that it's actually been studied, and a framework is developed for it, because it really is a real issue where Black women are afraid to be seen as weak. And they have the determination to succeed despite their limitations. And it's the way that they process and deal with stress and how they respond to it that is overshadowed by their need to help others, even if it's to the detriment of themselves. So this is a real thing that has been studied, and it is something that greatly impacts our mental health, as well as the likelihood that we'll seek treatment for our mental health. So
Absolutely.
these are such important things to bring up and highlight. And anybody listening, if you're feeling and experiencing this, just know that this is not just you. This is a real thing. So another important factor that affects maternal mental health that I'd like to briefly talk about is intimate partner violence. And here's some statistics for you, some sobering statistics. 20% of pregnant women experience violence during their pregnancy. And that makes it more common than a gestational diabetes or preeclampsia diagnosis, which I'm sure we've all heard of or known somebody that's gone through that. And this has a major impact on pregnancy. It's also linked to depression, substance abuse, smoking, anemia, having bleeding during the first and second trimesters, not gaining weight or eating properly. And also, because they're scared to go to the doctor, it delays them getting prenatal care. So now what does this mean for healthcare providers? I have a couple of statistics about that aren't so great. Only 18% of women that were examined during this study at a very busy urgent care triage center were actually asked about intimate partner violence by their physician. So they weren't even being screened for it. A large amount of women were not, pregnant women. And then in another study, less than half of this was a study done on victims of homicide or attempted homicide. Less than half of the healthcare providers actually routinely screened for domestic violence. But 47% of those cases, the victim of the crime had actually gone to the doctor within the last year. So I know as clinicians, we're used to asking our patients, do you feel safe at home? Is anyone trying to keep you from seeing your friends or family? Those questions to get the conversation started so we can find out if there's anything going on that we can help with. And sometimes when the patients, reel away, like, why are you asking me that? I let them know it's just so that we can help you if you need any help. That's all we want to do, is just make sure there's nothing that we can help you with. So that really highlights the importance of doing these screenings so that we can identify these people that need, these women that need our help. And so now that we've laid the foundation and groundwork for the problem, let's talk about some solutions. Dr. Henderson, I'm going to take it back over to you. Can you give us some strategies to assist pregnant women with prioritizing their mental health?
Yes. One of them is, we're doing it now. Educate yourself, right? Understand how mental health can be impacted. As I said in the beginning, before, during, and after pregnancy. Know that when you are feeling what you are feeling, the things that we talked about, the very serious feelings of depression, anxiety, when you're feeling those things, communicate it. Let your providers know how you are feeling. Lean on your support system. And if you don't have one, get one. And the importance of self-care in this process, and I know Novella is going to talk a little bit about that. I'm excited to hear. Get your physical activity in. Take care of your nutrition. I know that one of the sessions that you've given here has been talking about that. So self-care is a critical part of the strategy for dealing with mental health.
Yes, and thank you for referencing our past webinar, as we really are trying to give a comprehensive approach to this problem, and nutrition is a very big part of that. Novella, Dr. Cheryl had given you a little bit of a introduction into your question. Now let me ask it. What impact does self-care and strong support systems have on the overall mental wellness of the pregnant woman? And can you give some examples for us, please?
Yes, this is up my alley. Self-care and strong support systems help us to manage stress and build emotional resilience. Self-care is, I think, a term that we just like to throw out there. I'm going to do, but I don't know that we really do embrace self-care. And self-care looks different for everyone. For me, that might mean exercise. Stacey might look at me like I'm crazy and say, exercise is not self-care for me. But self-care, like I said, self-care can mean meditation, yoga, weightlifting, a walk, just watching the sunset or sunrise with a cup of coffee. But it's so important because it reduce it what am I what's the word releases those feel good endorphins, those feel good hormones, and reduces those stress hormones. So it's really like exercise. It's so important for that. So again, exercise can be different. So it could be yoga for someone else. It can be for me going to do a CrossFit class. But it's so important to distract you from worry. Can definitely reduce things like anxiety. It can boost your self-confidence. It can stimulate brain growth. And then another thing is having strong support systems. Again, we are strong women, we're independent women, and sometimes we don't rely on our support systems. We don't ask for help. And strong support systems are so important for emotional validation, for assistance, for that practical help during times of crisis. So it's like Dr. Henderson said, if you don't have that support system, make sure that you have someone that you can rely on, someone that can help you. Think of the relief it is if you have to pick up the kids from daycare and you have to work late, that someone says, I'll just step in, and the relief that feels. So having that support system is really important. And again, that self-care. Some people, a massage is self-care, but I know that I talk about it for myself. Oh, I'm going to have a self-care day, and it really never happens. So I really encourage everyone to ensure that they are plugging that into their calendar and making sure that it happens.
Thank you. Thank you so much for that. And one of the things that you said that stood out to me in the support system, um, we encourage the support partners of pregnant women to also attend these webinars, because this information is equally as important for them to see the role that they can have in making their partner, their loved one's pregnancy successful, whatever the dynamics of that relationship are. So thank you for lifting that point up. And I just want to make sure that we still have people putting questions into the Q&A. I want to again lift that up and direct everyone to put all of their questions in the Q&A, because we're just about ready to start doing those questions. I do see in the chat we have Lushana Thompson, a doula, in here with us. Thank you so much for joining. We appreciate that. So I'm going to give everybody some time to start asking their questions. But I thank both of you ladies for this robust discussion of really highlighting and bringing awareness to the problem of mental health in pregnancy, and how it can go largely undiagnosed, untreated, and not addressed. And it has very negative outcomes for the mother, for the family, for the child. So we really want to make sure that is uplifted and addressed. So any questions now? I don't see any just yet, but Novella, I have a question for you. You're a Santiwa Fitness. Can you please, because I think this would be very helpful, this is your wheelhouse, of telling us some of the offerings there, the things that you do that would be helpful for us for self-care?
Sure. So we do full body workouts. We use body weight, we use dumbbells, we do cardio. And one of the things that I hear so often is people are intimidated to come through the doors, and people are worried on what it will look like, and I can't do that, or I've had people come in and feel embarrassed. And it really is a place for you. One, I feel, again, the mental health piece, it's a place for you to feel empowered and encouraged. So I don't want anyone to come into my class and feel discouraged. So I make sure that every workout fits and tailored to you. So you might look different than the person next to you, but it's about just getting you moving. And for me, it's more than aesthetics. It's about combating those chronic illnesses, like you said in my bio, just getting ahead of that. I'm a woman of a certain age, and I'm in that menopause stage, and just getting ahead of that before you hit that stage is so important. So it's a workout for everyone, and we do everything there.
Thank you. Thank you for sharing that with us.
Thank you for allowing me to share.
Just checking out the Q&A again. All right. Dr. Henderson, is there any last words that you would like to share with us? Any points that you wanted to get across?
Sure, absolutely. The final, it sounds like you were reading my mind, Stacey, because I was saying, I just want to say this, that it's okay if you experience some of these big emotions during or after pregnancy. It's okay. But please ask for help. Because
That's
of
so
everything
important.
everything that we've talked about, it is all of these things are undiagnosed and they're not treated. And so you can be your own advocate in asking for help.
Thank you. That was a great final word on that. Advocate for yourself and what you need. Seek out the help that you need. Absolutely. So let's go to the Q&A. I almost thought we weren't going to get any questions. We did such a wonderful job explaining everything. We left no stone unturned. So our first question is, hi, my name is Abby. Thank you for putting this together. Could you touch on the role mental health plays in generational trauma?
A role that mental health plays in general. It
That's a
plays
big
role.
one.
Yeah, it's a big role. I mean, generational trauma, we experience it given the history and the history of suppression and the treatment. We all experience it to some degree. And yes, it does play a role in depression, anxiety that is experienced by Black and Brown people in this country.
It is. It's a very real thing, and it's so strong because it's passed down and it's learned behavior. So it is very tough and hard to overcome that and change the tides and decide within yourself to do different, because sometimes that's all we know. So, it is something that you're going to have to seek out help for a lot of times, to help you realize why you do the things you do, because some people don't even realize that their behaviors and their trauma has something to do with what they've learned growing up, and to help you make that connection and work through it so that you can grow and do better. I saw a very, very interesting question. I'm excited about this one. How can the male counterparts assist in identifying signs of mental stress and be of help to reduce the stress? I love this question. Do either one of you want to take a stab at that?
I think it's about communication. Again, communicating that you need that support, communicating what stress looks like when I'm feeling stressed. This is what I do. I think you mentioned the male counterparts attending these webinars so that they have the tools and strategies to attending medical appointments, and just being knowledgeable about what's going on in the woman's life, and understanding through communication what does support look like. So having that communication prior to being in crisis or being stressed out, having those conversations. This is what help looks like to me. Can you do the dishes or pick up food so that I don't have to cook? Just having that open communication before you get in a point of crisis or when you're stressed out. I don't know, Dr. Henderson, if you wanted to add to that.
Well, I just wanted to add just what's in it for me kind of information for the male, for the father. If your pregnant partner is stressed out and overwhelmed, guess what? It affects you too. And the rate of depression and anxiety increases in the male partner. So there's helping out and supporting, there's something in it for you.
Yes. And it goes back to what we were talking about with the mental health symptoms presenting differently in Black women. So it
Mhm.
may not be, crying or something that you would easily identify. It could be because the way we are trained and conditioned that it looks like irritability, like she's just getting mad at you all the time and
Yeah.
snapping, but there could be something really going on inside that's causing that. So just paying attention and being aware of the signs that if their behavior seems a little out of the ordinary, dig a little deeper and let them know that you care and you're there to support to get them to open up about what's going on. And then seeking assistance outside of your family or going to the pastor to pray. Sometimes we actually need professional help so that we can have the best outcome and actually come out better out of the situation. So be supportive in that if professional help is needed, that you are on board with that as well.
Stacey, I think actually that question was really good because to your point about intimate partner violence, making sure that everyone's on the same page and understanding, because intimate partner violence increases tends to increase when women are pregnant. So having that understanding and discussing how we're going to resolve conflict prior to the conflict happening is really important for that reason as well. So I thought that was a really good question.
Yes. All right. So I have another question here, and I'm going to pull up. It actually appeared in the chat. What are some effective strategies or approaches to support a pregnant Black mom who is reluctant to engage in therapy, especially when addressing mental health or emotional well-being?
So the question reflects, how do you get someone who is in need?
Yeah, so it seems like the question was, how can you, if they need it but they're reluctant to join in and participate for some of the reasons that we talked about already. They don't want to appear weak. We're conditioned to be strong. So how can you help and support somebody that is experiencing those stigmas that we talked about?
Well, supporting them and encouraging them to let them know that they can get help, that they can find, uh, and I think that it's important to make this point, a culturally competent therapist to help them and who will understand their worldview, their perspective, and what they're going through, and that you will support them with that. And I think that helps encourage someone who might be reluctant. Because many times people are reluctant because they've had bad past experiences. So,
Mm-hmm.
so they're reluctant to do it again. So,
Or they're scared of what others might think. And if you're that person that tells them what they're feeling is perfectly normal and it's perfectly fine for them to seek out help, and they're actually brave for getting help, the opposite of what they're thinking, that it's
mhm,
making them strong to seek out, help, then, that can help give them that confidence boost that they need, that it's okay for them to do it.
yes, absolutely.
Did you have anything to add, Novella? We got one more question that I can see. Yep. Okay, so I'm going to pose this last question. Can you share how you set boundaries between work and personal life to protect your self-care?
I'm
I'm gonna
currently
take
working.
myself out of the equation because I don't know if I've achieved this myself.
And I haven't either. I'm actually working with my therapist on setting boundaries for work and to have that work-life balance. But that's such a great question, and it's so important. And I think, for me, setting an alarm when work stops, not when work starts, but when work stops. And because again, that mental health piece, if you're working nonstop, and again, I have to take my own advice, but setting an alarm when to stop and just setting boundaries, like you said, when work starts and when it ends, and really holding true to that is really important, because that work-life balance is really, really key to your mental health. Um, but I don't think I'm an expert on that conversation.
Well, I always think about that work-life balance thing as it doesn't mean that it's even, that work and life is equal. Doesn't mean that. It means that when you are in your life, you're present. You're not at work. So being mindful, being present. Um, one of the things that for me, and I'll just share, for me that is grounding and being present is I listen to music as a way to, to make that distinction and come out of the work mode. I have a four-legged fur kid, uh, chocolate lab that I walk in nature, and that helps me to be present and mindful as opposed to thinking about work, right? So balance is about being present and mindful.
I felt that all the way. I never heard it explained that way or brought out that way, and I absolutely love that.
Same.
Consider that stolen. I'm gonna put it on my as a
Yes.
quote in my emails. That's amazing. Thank you so much for sharing that.
Yeah.
All right. So that was all of the questions. I want to thank you ladies again so much. This was such a great discussion. I feel like we had some healing. I feel like we accomplished a lot. We brought awareness. We gave out some really good strategies. And I hope everyone leaves here feeling full from the information that was presented. So now what we're going to do is do our final poll, our post-webinar poll. So I'd invite you again to, when the poll pops up on your screen, to please participate in the poll, and you will be entered into the drawing to win a $75 gift card. Again, we will announce the winner tomorrow and get in contact with you, but we'll give you a couple minutes now to complete the poll. Thank you all for participating in the poll. We have some announcements that we want to make before you all leave. We have an upcoming webinar, our next webinar, which is going to be on February the 5th, 2025, 7:30 again, same time, that we invite you to register for. And that one is entitled Perinatal and Infant Mortality, Prevention and Best Practices. So we have a very good panel discussion, and we hope that you all will be able to join us for our next webinar. And then after that, we'll have our summit coming up on April the 12th. We have an early bird special going on from now until February the 28th. Where tickets to the summit are discounted. So make sure you get in there early so you can save some money. It is going to be a day of awareness, empowerment, uplifting, so that we can attack this problem. It is from 10 a.m. to 4 p.m. at Southern Connecticut State University. If you attended our summit last year, I'm sure you left enlightened, and we promise this year to be just as impactful and enlightening. So I will close out the webinar for the evening now, inviting you to scan the QR code that's going to come on your screen in a second. And that will take you to find out all of the things that we have coming up, what we do, videos that we've posted. So please make sure that you scan the QR code that should be coming up shortly on your screen, and check out all of the things that we have coming up. Thank you again all for attending this webinar tonight.